My opponent says it's good to have health care, but my team and I say Obamacare is bad and it needs to leave our failing government. It's just not right It's just not right. According to Michelle F. Cannon, the health care law is still unpopular, unsustainable, and very vulnerable. In some cases, it's unconstitutional because it's forcing people to have abortions and blood transfusions in their plans, which in a lot of religions, it's a taboo, and taboo is a bad sin or crime. According to the First Amendment to the United States Constitution, prohibits the making of any law respecting an established or religion and impeding the free exercise of religion. That's why I think we should take Obamacare out of this government. It's just making it worse. While my opponent may say that the Health Care Act is unconstitutional, or they have to include abortions and blood transfusions, just because it's in their plan does not mean they have to do it. So if they don't want to and they don't believe in that, then don't have the abortion or a blood transfusion. So therefore, the Affordable Care Act is good for you and can help save lives.
What my opponents may say is that Obamacare doesn't help anyone. But we disagree because it provides the affordable care and their needs. According to the Affordable Care Act, health care for 30 million more Americans will be made wealthier because more jobs will be formed. If we provide affordable health care for more Americans, we would need more medical-related jobs to care for these people. This is good because it helps the economy grow and people would have jobs. Obama would provide jobs for nurses, doctors, therapists, and even health receptionists. In the words of the Affordable Care Act in 2012, healthcare hiring accounted for nearly 300,000 jobs, placing healthcare sixth for the year. This means that the healthcare field was ranked sixth in providing jobs for people. These jobs help us Americans become wealthier because they provide payable jobs from Obamacare. The affordable care is good and will benefit anyone's need from now until it may end. According to Paige Winningham, author of the Affordable Care Act, will not control health care costs, and because newly insured will be younger and healthier on average, since people who are going to be will be newly insured and younger and healthier than those who are currently insured, we won't be spending much money insuring them. We weren't before. Therefore, since Obamacare will be accumulating newly, younger, and healthier clients, which means we will be saving more money, obviously this means Obamacare helps many people's needs. Thank you.
My opponent may say that no one has to take a blood transfusion or an abortion, but I disagree. Because if a life can be saved, a doctor cannot let someone die under his or her care. If someone's life can be saved and they need to have a blood transfusion, they have to take it. They won't take no for an answer, because if you were to die, you could sue the hospital, and that's not something they want or can really have.